Spinal stenosis is when you have narrowing of the spinal canal, and that can be from arthritis, it can be from a disc herniation, it can be from bone spurs growing into the spinal canal. This would be the spine, and then this would be the spinal canal where you have the narrowing. And there's a couple of different ways you can approach that. You could do what's called a laminectomy, or if there's a question of some stability, you could do a laminectomy infusion where you have to put instrumentation. The problem with a fusion is that when you fuse two segments together, what happens is that there's a lot of stress at the level above, and that can cause early wear of that disc and thus need further surgery down the line because you did that fusion. So in my practice, I try and do everything I can to avoid a fusion and avoid that problem of adjacent segment degeneration down the road. And so what I've developed is a procedure. It's a minimally invasive midline sparing hemilaminotomy where we just come on either side of the spinous process, which is the middle right here, and we open up both sides and try and preserve as much of the natural anatomy as possible, keeping things stable but still achieving the ultimate goal of taking the pressure off the nerves. And that to me is, although it's a little more tedious, is worth it in the sense that if you can avoid a fusion and hardware and a bigger surgery, more blood loss, more time in the hospital, it's worth it.